Good day, everyone. Welcome all to the first webinar of MediGence, titled Global Healthcare Made Accessible. My name is Stiling, and I'm with our COO, Gunet. To kickstart the webinar, let me introduce you to MediGence. MediGence was founded in 2016 and is the most trusted, reliable, secure medical platform that facilitates telemedicine, second opinion, and medical travels. If you're looking for affordable, quality medical treatment abroad, MediGence is here for you. At MediGence, we help you find the best hospitals and doctors from our network of top quality hospitals in India, UAE, Turkey, and other countries to treat your medical conditions. Our COO, Gunit, will give us further information on MediGence.
And thank you so much, Sileng, for the introduction about the company and about us as well. So I'd like to first of all greet people of Botswana. And just to introduce MediGence to you all, MediGence is a healthcare tech company, which primarily started off as a medical assistance company for people looking for medical treatment abroad, who primarily could not be treated in their home country, or maybe who are looking for better access abroad for their particular medical condition. So we primarily started off as a medical travel company. However, since then we have diversified ourselves into different areas which are primarily related to healthcare. COVID was a very it was actually a very challenging time for everybody around the world, and it actually made us realize how difficult it is for people in such a scenario to access healthcare within their home country, as well as people looking for better medical opinion, or maybe they need some guidance on their medical condition. So that's how initially we diversified into something called telemedicine as well, which provides access to medical opinion from some of the specialists from around the world, for all particular medical conditions, for neurology, neurosurgery, cardiac surgeries, for transplantation patients in particular. So telemedicine is another one thing that we diversified into, and then we came up with something called second opinion, which for which we have a dedicated platform by the name Think Twice, which allows access to people who are looking for specialized medical opinion from a team of doctors, and they are suffering from a critical medical condition, and they are looking for opinion from a team of doctors on whether their diagnosis is correct or not, whether they are being advised the correct thing or not, whether there are better treatment options available, whether they can be treated or not perfectly well, what will be the success rate like, what will be the prognosis. So that's another aspect of MediGence, which was implemented. And then there are other things like telerehabilitation services as well, which forms a very important part of remote healthcare that we are delivering to people around the world at the moment. So people who cannot be treated surgically, or who are dependent, or maybe suffering from chronic neurological conditions, neuromuscular disorders, who require guidance, as in to maintain themselves and to be as independent as possible, or to improve their medical condition, their clinical status. So we do have exclusive telerehabilitation programs available as well for these patients. So at the moment, there are a lot of things that we are working into. It's not just about medical travel, but it's also about delivering healthcare to where you are actually located.
Very interesting. Accessing global healthcare has been difficult. And now with the pandemic, it seems impossible. How it's complicated. How do you foresee this as a challenge? Gunet, please share some more insight on this.
Okay, so COVID, as I explained as well, COVID came suddenly, and everything was at a halt. People were not able to access healthcare in the hospitals. Hospitals were actually flooded with patients in certain countries. Initially, even doctors or immunologists or everyone was working, researching about what it is, and the hospital infrastructure, in a way, it collapsed in many countries. So there were a lot of people, in fact a majority of people, who were not able to have access to healthcare, and that's what made us think, because COVID is something, or maybe it goes for all kind of pandemics. There is no there is no certainty that it won't come back again. So we need to have solutions in place that that ensures that patients have access to healthcare no matter what the situation is. And this is where the entire virtual healthcare, or maybe healthcare accessibility, comes into place, which can be delivered through different models that we are continuously or actively working on. So in COVID times, a lot of people prefer to get telemedicine consultation done, even patients who were sick, who wanted medical advice, who could not visit hospitals. The OPDs were not there, or maybe doctors were not available. However, they were available through us on a click of a button. So, there were patients who were booking consultations online. They were getting on telemedicine consultation calls with doctors from around the world, getting opinions on their medical reports, or getting advice on how they can manage themselves while the pandemic is over. And so it's something that must be implemented everywhere, and it's something that patients must be looking forward to, especially in case if they are not able to access healthcare, or maybe not personally able to visit a clinic because of whatsoever whatever challenges. But telemedicine is something which is available freely to patients of Botswana as well. If somebody is looking for specialized medical opinion, they can book a consultation with a specialist anywhere in the world at a click of a button. So that's how the healthcare delivery model has changed since pandemic, and it's actually very beneficial for the patients.
Wow, you have answered my question even before I asked it. I was just about to ask you, how can people who are not in India access your services? But like you've just said, with the teleconsultations, it has made everything, it's making everything possible, hey?
Yeah, and in fact, it's actually good for the patients as well, with even for patients who are deciding, looking, who are in the process of deciding whether they should go abroad, or whether they have been diagnosed correctly, whether they are receiving the right treatment, whether there's something which is better, or which is available to them at a better price, or maybe something which can be delivered in a better way. They have been suggested an open surgery, and they can be treated in a minimally invasive way, or with the help of completely non-invasive way. So I think it's always better to have that kind of expertise available, and it's always better for patients to have access to the right specialists, so that they can discuss about about everything which is available to them. And people should be aware about whatever services are available to them, that they can access.
Interesting. Now, how do you assist those patients who have never been abroad, and the procedures can only be done in India or in Turkey or in any country that MediGence is available at? How do you assist those people?
Okay, so there have been a lot of patients from Botswana in particular, and nearby countries as well, like Zimbabwe, Zambia, who travel abroad for medical treatment because certain treatment is not available to them, or maybe there is a huge waiting time, as in they are scheduled for a surgery for after 6 months, and their situation is not not such that they can wait for months to receive treatment, and they are happy to pay privately for medical treatment. For such patients, at MediGence, we have two set of teams available to assess such patients. One team is completely responsible for, which is the clinical team, which is completely responsible for understanding the patient situation, reading through the reports, and then discussing with the patients about their symptoms, assess what's the urgency of treatment, whether they can wait, whether they should get it done, and then discuss it further with the doctors from the country of their choice, as in, if a patient is looking for medical treatment in India or maybe Turkey or Dubai or maybe even in the UK or some other countries, then they discuss the reports with the handpicked doctors as per the condition of the patient, and then provide the recommendations to the patient in the form of a document that, these are the options which are available, this is how much it is going to cost, and then take it forward from the patient, answer their questions about treatment, prognosis, success rates, and everything. And then once they have made up their mind that yes, we want to travel abroad now, and this is the doctor or the hospital or the destination that we want to go ahead with, then the operations team take over, and they take care of the visa assistance and issue the medical visa invitation letter, provide guidance as to how to apply for visa, and then they provide assistance with respect to hotel bookings, airline bookings, airport pickup, hospital appointments, and admission and discharge and everything. So there are two sets of team. One team handles everything clinically, and then until the patient has decided that yes, this is what they want to go ahead. And then there is operations team as well, who takes care of all the logistics and transportation and appointments and stuff. So we have dedicated teams and people who are available around the clock to manage everything for people who are looking forward to traveling to a country where they have never been before. And they have a lot of apprehensions, in particular about food, about the place where they'll be staying, and how far is it from the hospital, and what will be the arrangements like. So we do have a dedicated process for everything to handhold them throughout the process until they have received the treatment and they have traveled back to their home country.
Okay, that is very good. So now, are you saying we should know that, rest assured, we're safe? Remember, nowadays people are being trafficked.
Yes.
So we are safe. We're sure that you guys are going to be, MediGence is going to be taking care of us from the moment we get to India until we come back home.
Yes. So irrespective of the destination that they choose, whether it is India, whether it is Turkey, whether it is Dubai, so we do have representatives available who pick them up from the airport and then assist them throughout the appointments, through admission, through discharge, afterward for the follow-up appointments. There is a dedicated patient care manager who is assigned to each and every patient, so that they take care of them personally, about their issues, about everything, to make sure that they're safe. And our responsibility doesn't stop the moment the patient has received treatment. So it continues throughout the follow-ups, and even after the patient has traveled back, the same patient care manager and the operations team stays in touch with the patient to make sure that the recovery is taking place. And if there is any kind of need of the follow-ups, or maybe post-operative management, or virtual consultation with the treating doctor, or any review on reports which are required, so the process continues even after the patient has returned back to the country.
Okay, so what certification does MediGence have for those patients who want to travel for their medical treatments?
Okay, so MediGence is actually TEMOS certified, which is a German certification for medical assistance companies in particular. So there are certain parameters that companies have to fulfill, and certain processes that every company needs to, every medical travel assistance company or a healthcare company needs to have before they can get this, German certification. So we are TEMOS certified, and which means that we have achieved that level of quality in terms of a medical travel coordination. And it also means that we have a very strict patient privacy policy, as in all the patient data which is shared with us, we have a patient privacy policy that applies. And there is a limitation as to how and when and with whom patient data is shared by us, whether internally within MediGence or outside with the doctors and the hospital. So there is a process to that, and that's the reason, which is one of the aspects of TEMO certification as well. So we follow all these guidelines very strictly and have achieved that level of excellence in terms of overall patient care coordination and internal processes to make things easier and better for our patients.
Interesting. Now, going back to what I said earlier on about affordability.
Yeah.
Would you say, if I was a patient, for example, I wanted to go and have a back operation, and another person has a knee operation that they want to do, are we going to be paying the same amount, or what are we going to do? How do you evaluate that? Do you evaluate that looking at what are my medical records that I've shared with you, and here's please help us understand.
Yeah, so it's actually a good question. So affordability has a different definition for everyone. So yes, medical records, especially in case of, you shared example of back and knee as well. So in both these cases, radiological images, they play a very important role, as in, you need to have an X-ray or an MRI or a CT scan available for us to make an accurate diagnosis, because somebody suffering from a lower back pain, the person may have different diagnosis. The person may have a disc herniation, there may be some kind of nerve impingement, there may be some kind of, disc erosion. So you need to have a definite diagnosis to be able to arrive at the cost of treatment. So that is the reason, our medical team, they ask for a certain set of reports depending on what the symptoms of the patients are, and depending what diagnosis the patient is describing or maybe sharing with us. So maybe a patient coming in for knee replacement says that, I need knee replacement, so what will be the cost? So we give a tentative estimation that yes, this is going to be the cost. However, the final diagnosis will be made on the basis of certain tests which are done. If you have them, you can share it with us so that we can make an assessment. And then if you don't have them, then all right, this is a tentative estimation, but then final estimation can only be given on the basis of clinical assessment, which is done when you are seen in person by the doctor. So yes, cost depends on the diagnosis or the actual diagnosis of the patient, because that further decides what kind of treatment the patient may require, whether there is any need for surgery or the patient only requires rehabilitation or something like that. It only cost varies as per that. And cost also varies on the basis of the hospital or the destination that the patient may choose. So any procedure, any spinal surgery, if it costs around $20,000 in South Africa, it may cost around 10,000 in Turkey, and it may cost around 6,000 in India. So it also depends on the destination that they choose. Every country has its own pricing policy, and the cost of treatment in every country is different. So this is how it goes, and it's very important for the people to know the options that they have on the plate before they actually decide on anything. This is especially important for people who are paying out of pocket, or maybe who are private payers, and they want to pay for their treatment abroad.
Okay. Now, do you see yourself setting base in Botswana anytime soon?
Of course, yes. We are, in a way, we are already there in Botswana. It doesn't feel like that we are not there in Botswana. But yes, very soon we are going to have a regional office in Botswana, wherein we already have the brochures out with the contact number of the people. They can call locally in Botswana if they need any kind of medical assistance, even for remote healthcare or maybe travel overseas or anything like that. We do have everything available, and with this video, we are also going to post the information in the post copy, as in these are the contact numbers that if somebody looking for any kind of medical assistance in Botswana need to contact us, they can contact on the local numbers provided in the video. But yes, very soon we are going to have a regional office wherein patients can drop by. They can know more about our services, and also ask for any kind of recommendations or any kind of assistance they need for medical care, whether it is for telemedicine or just an opinion, or maybe for travel overseas, even for telerehabilitation.
Very interesting. Thank you so much for this informative and educative session. Good night.
Yeah, thank you so much, Tileng. And it was nice having this conversation. And hopefully, we will collaborate again for another video very soon. And I'll just request people of Botswana that if you have anything that you need to ask, feel free to contact us anytime. Our patient care advisors are available around the clock to provide the support and to answer questions and everything. So feel free to ask. It's we are there to help you out.